It's often dismissed as just a headache, but a migraine attack is much more than that. 15% of Americans are affected, but as Stephanie Sy reports, the stigma associated with migraine disease has meant fewer resources for desperate patients. The story is part of our regular series on the leading edge of science, technology, and health.
Eliana, do you have a 4?
For Jen Tingwald, playing Go Fish with her family could be a metaphor for the past 5 years, fishing for relief from the pain of chronic migraine.
Go fish.
We never thought that the sickness would come before the health in our marriage. So that's been really hard.
Tingwald had her first migraine attack when she was 31.
That's really where my journey began, and to some degree my head pain has not left since that day. So like in my left temple, I always have pain. The intensity changes, but it's always there, it's always present.
This is your nightstand.
Yeah, otherwise known as my mini pharmacy.
The once aspiring nurse now spends hours a day managing her pain. An ice pack has become a near permanent fixture over her left temple.
Joanne will actually start your IV. Okay.
She frequently receives a cocktail of migraine and pain medication administered through an IV.
At minimum, I'm here 3 days a month, at max 12 to 15 days a month.
Tingwald is on the severe end of the migraine spectrum, but she's just one of 47 million Americans who have the disease, 75% of whom are women. The symptoms can be debilitating. 3 generations of Shirley Kessel's family have migraine.
I have ringing in my ears 24/7. I have light sensitivity. I have sensitivity to sound and smells. And then when the headache comes, it's just like an explosion in my head.
Angie Glazer gave up her dream job as a national park ranger because of migraine.
My brain kind of feels like it's in a bowl of water, kind of like slishing around. But sometimes I'll get these waves of vertigo where I'll move my head and the whole room will just flip.
Striking, stabbing pain. So almost like somebody has like a hot, sharp ice pick and they're just stabbing it straight through my temple.
Right here at my finger.
Dr. Amal Starling treats Jen Tingwald at the Mayo Clinic in Arizona. For her, the search for an effective treatment is still ongoing. Starling says the last few years have seen more options become available, but most work on only 50% of patients.
Stress can be a trigger, a lack of sleep can be a trigger, different foods, different allergens, all these things can be potential triggers, but they are not the cause. The cause is it is a genetic neurologic disease.
For mother and daughter, Deborah and Elena Sibb, migraine has been a part of their lives since Elena was in the 3rd grade. About 10% of school-age children have migraine.
It's more than just a headache. That's why I didn't mention head pain.
I don't know if you noticed, but her speech, that's a symptom of migraine.
Yeah.
Like your speech is kind of, Can you explain that thing that happens?
No, my tongue it feels like it's like too big for my mouth. And
it's hard for her to.
I can't talk right.
CBS 2's Serene Brown.
Another example of this phenomenon was captured on camera with this local news reporter, Serene Branson.
Well, a very, very heavy debatation tonight. We had a very
Starling explains what's happening in the brain to cause these symptoms.
The trigeminal nerve is the nerve that innervates our entire face, as well as the covering of our brain. Okay. And that is the nerve that is becoming sensitized during a migraine attack. That's where you'll develop that sensitivity to light and sound and motion, as well as what we call the emotional aspect of pain and the processing of pain.
So pain is not a certain area of the brain. It's sort of
a network.
It's a network throughout the brain that's affected during a migraine attack.
Correct. And again, it's the abnormal function of that network is what's resulting in migraine.
The Mayo Clinic here in Scottsdale, Arizona is one of the largest migraine and headache treatment centers in the country. And people come from all over the U.S. because there simply aren't enough migraine specialists to treat the millions of people who have it.
One reason leading to the lack of specialists comes down to a word we heard over and over from patients.
The stigma.
Yeah.
The stigma, the burden that comes along is sometimes almost worse than the disease itself.
Very frequently, they'll say, I was told that this is just all in my head. They think that it's all in my head.
That it's psychological.
Correct. And I have to tell them, well, yes, it is in your head because your brain is in your head.
Jimmy, please, not now. I'm too busy. Control yourself. Sure you have a headache?
The stigma attached to migraine is likely rooted in gender stereotypes, says sociologist Joanna Kempner.
They're inevitably discussed as people who are neurotic, maybe a little too caught up in their housework, maybe a little too worried about what their husbands are doing. You know, I'd like to say we're past those stereotypes, but they still kind of color how we think about women with migraine.
But more and more famous women have shared their migraine struggles. Tennis great Serena Williams says she's lost matches because of migraine. And Cindy McCain spent much of her husband's presidential campaign in excruciating pain. Having kept her symptoms hidden for years, she's now an advocate for more research. Advocacy around the issue culminates every year in Washington, D.C., with an event dubbed Headache on the Hill.
3, 2, 1.
This year, some 200 activists lobbied Congress for more federal funding for research and education.
Next year's Headache on the Hill.
A lack of funding is one reason why many migraine patients say there aren't more effective treatments.
You may be in bed for a day or a week or 2 weeks after this.
Katie McDonald leads the effort for the Alliance for Headache Disorders Advocacy.
At the federal level, there are organizations and agencies that make decisions to not support migraine because they don't feel like it's a big deal. And so we're trying to change that perception, reverse that, and get more attention brought to migraine.
For 2020, the National Institutes of Health has allocated $27 million for migraine research, a paltry amount, say advocates, for a disease that affects 15% of Americans and leads to billions of dollars in lost productivity annually. For comparison, the NIH allocated $31 million this year to anthrax, which affects just a handful of people every year. Just to attend this year's Advocacy Day in Washington, the group faced a world of potential triggers, from the rainy weather to the bright lights and loud, echoey halls. And even the noise of applause, which required an adaptation, waving hands instead of clapping.
You're my first meeting.
Dr. Starling and her patient, Tingwald, met with representatives from their home state of Arizona, including the legislative director for Congressman Ruben Gallego.
There are not enough headache specialists. 47 million people in the U.S. with migraine. There are 564 board-certified headache specialists.
Wow.
By lunchtime, Tingwald had to put her ice pack and sunglasses back on.
This isn't the life I imagined for myself. This isn't what I thought I would be doing. But at the end of the day, I'm doing everything that I can to treat it and to find, if not a cure, the best quality of life that I can.
Tingwald and her fellow advocates aren't giving up. In their push for better treatments, more research funding, and more understanding of migraine. For the PBS NewsHour, I'm Stephanie Tsai in Phoenix, Arizona.